Hello everyone, in this video we'll be going over pericarditis. We'll be first going over a mnemonic to remember the diagnostic criteria for pericarditis, and then we'll also be going over the treatment. Now, I have a quick mnemonic that you can use if you want for remembering the diagnostic criteria. When writing pericarditis, you just add an extra E to remember the mnemonic PEER. So the P is going to be for pleuritic chest pain, which is going to be the most common presenting symptom of pericarditis. The E is going to be to remember the ECG changes that occur. There's going to be these diffuse ST elevations that we're going to be seeing on the ECG. The other E is going to be for the echo findings. There's going to be a new or worsening pericardial effusion on the echo, and the R is going to be for the pericardial friction rub. We will be hearing that on auscultation, and 85% of patients have this. Now, this is a quick image for pericarditis. Pericarditis, again, is going to be the inflammation of the outer layer membrane of the heart. Now, here is a ECG of a patient who has pericarditis. As you can see, there's going to be these diffuse ST segment elevations throughout. And if you take a look at a echo of a patient with pericarditis, we can see over here that there's some effusion going on. So this plaque is going to be some effusion, and here there's also some effusion. So this is going to be another feature that you can look for diagnosing pericarditis. Now let's go over the treatment. So anti-inflammatory therapy is going to be our mainstay treatment option. We're most likely going to be using ibuprofen in combination with colchicine, which is going to improve treatment response and reduce recurrence risk. NSAIDs like ibuprofen are going to be important for symptomatic relief. And when we add colchicine, that is going to improve the treatment response and reduce the recurrence risk. So the combination use of NSAIDs plus colchicine is going to be common. Viral cause is going to be the most common etiology of pericarditis. And if the cause of the pericarditis is viral, then we're not going to need additional therapy, but we need to look out for additional non-viral causes of pericarditis like bacterial, autoimmune, uremic. And then if there is a non-viral cause, then we need to treat the underlying condition as well. Now, patients also need to limit physical activity until the symptoms resolve and the CRP normalizes, and athletes may resume training only if ECG and echocardiogram findings are normal. Now, if NSAIDs and colchicine are contraindicated or ineffective in patients, then we can use glucocorticoids, or if the patient has an underlying autoimmune disease that might be causing the pericarditis, then we can also use glucocorticoids in treating pericarditis. So hopefully this video helps. Thank you for watching.